For centuries, there was no such thing as a black swan. It was a fact. All swans were white. In fact, it was so true that by Shakespeare's time, it became a common expression in Latin. Here it is. Rara avis in terris negroque similima signo. When a fact becomes so widely accepted that people repeat it in Latin, that's a sign of it not just being true, but extra true. Then all of that changed in 1697, when Dutch sailors spotted a black swan off the coast of Australia. Suddenly what everyone in Europe knew to be true changed, and the idea of the black swan shifted from an impossibility to a perceived impossibility that is later disproved. Today in medicine, but not just medicine, all fields, we face a similar problem. But instead of white swans telling us what we think we know, and black swans challenging our assumptions, we have red swans blinding us to both. Fear of consequences of red swan events overshadows decision-making in medicine and a wide array of fields that hinge on human judgment. A defensive red swan mindset creates double blindness, enticing us to take action from fear and reactivity instead of common sense. We need to identify red swans for what they are and develop systems and strategies to help us see beyond them. Let me explain the three swans in more detail, and let me be clear. When I talk about swans, I'm not talking about actual birds. There is no such thing as a red swan, at least not yet. As they were for Shakespeare, the swans are a way of thinking, about our perception of what we believe to be possible and impossible, and our desire to control the future based on events of the past. So the white swans are what we know, established knowledge, best and accepted practices. So for doctors and surgeons like me, it's everything we learn in medical school and residency, the facts, the protocols, the evidence-based guidelines that we follow. White swans are tried and true, tested and confirmed by science. Things like knowing how antibiotics work, or the fact that an Alvarado score of 9 to 10 is diagnostic of appendicitis, while a score of 1 to 4 is negative, and a score of 5 to 8 is inconclusive, meaning more testing is needed to diagnose or rule out appendicitis. The Alvarado scoring system is a validated clinical prediction tool, a white swan that applies more or less to everyone. The black swans are the opposite of that. They are the unknown unknowns, things we cannot see unless we get to know the patient in front of us. Their values, their beliefs, their goals, their fears, their family situations, their financial constraints. Things we cannot know unless we get curious. So here's an example of a black swan. When Dr. Mark Schreim and colleagues studied patient preferences in the face of life-threatening illness, they found striking and unexpected variation. 31% of people wanted everything done, no matter the cost, while 8% of people would choose death instead of financial ruin for their families. Yet, how many doctors ask patients about their financial concerns before prescribing expensive treatment? How many doctors ask patients if their problem is one worth solving, given the risks and costs of what we call the $1 million workup? We can't imagine people not wanting everything done, no matter the cost. That is a black swan, something we cannot see unless we can imagine it and look for it. The red swan is different. The red swan is fear. Fear of missing something, fear of making a mistake, fear of being wrong, fear of a board investigation, fear of a malpractice lawsuit. Red swans tell us to order unnecessary tests just in case. It's prescribing an antibiotic for a viral illness because we're afraid of upsetting a patient and getting a bad Google review. It's transferring patients to higher levels of care, not because they need it, but because we're afraid of what might happen if we don't. This red swan fear costs us a lot. A University of Michigan study found that 99% of bacterial sinus infections are misdiagnosed by non-specialists. 99%. Not for lack of medical knowledge, not for lack of white swans, but because of red swan thinking. And despite spending more on healthcare than any other country, the US ranks last in health outcomes among high-income nations. Estimates of healthcare waste range from $750 billion to $935 billion annually, a big chunk of which goes to our bloated bureaucracy and defensive medicine, tests, procedures, and treatments ordered not for patient benefit, but to find and rule out every scary red swan a physician can think of. And the red swan doesn't just waste money, it corrupts medical decision-making at every level. When we are focused on protecting ourselves, we can no longer clearly see both the white swans, all of our medical knowledge, and the black swans, patient-specific truths. The red swan narrows our aperture, causing us to treat guidelines as rigid rules rather than tools. The red swan blinds us to patient-specific details that change treatment plans. Breaking free from a red swan mindset requires 3 shifts, starting with getting clear on our motivations. Before we order a test, or prescribe a medication, or recommend a surgery, or make a referral, we must pause and ask ourselves, is this for the patient, or is this for me? The red swan speaks in the language of what if. What if I'm wrong? What if I miss something? What if they complain? What if I get sued? By understanding the language of the red swan, we can distance ourselves from it and decide deliberately and consciously whether or not we want to listen to it. This must extend beyond individuals' decision-making to our institutional structures. Hospitals can create brave, safe spaces where doctors can talk about their swans, honestly and without judgment, and receive support in making patient-centered decisions. We put it right next to the doctor's lounge. We'll call it a swan room. Training programs must teach young physicians to identify fear-based red swan thinking early, showing them how to balance prudent caution with unnecessary defensiveness. We all need new frameworks that protect good medical judgment while maintaining appropriate standards of care. Just as crucial is reframing how we understand established medical knowledge. Those white swans are meant to illuminate our path, not dictate our every step. Evidence-based medicine works best when we treat it like a map showing possible routes, not a path from which we dare not deviate. Doctors need permission to combine their training with their intuition and judgment. Finally, we clinicians must step outside of our diagnose and prescribe brain and step into our human brain to get to know the patient in front of us, to uncover those unknown unknowns, those black swans. They hide in the stories our patients tell us. These moments of truth and connection reveal the context that shapes how a treatment plan will succeed or fail in a patient's real life. Making space for these conversations means checking our ego, our agenda, and our expectations at the door, and getting genuinely curious about the human being in front of us. The unknown unknowns, the black swans, only surface when we make space to discover them. And making room for these discoveries requires fundamental changes to how we structure medical care. Meaningful conversations must be built into the schedule. Payment structures must value quality of interaction, not just quantity of diagnoses and procedures. In short, when we align our values with our systems, we create conditions where better care becomes possible. Now, I know how hard it can be to get someone to see a red swan, even when it's right there in front of them. Last fall, my then 10-year-old son was lying, writhing in pain on an ER stretcher. Test for appendicitis had come back inconclusive. His Alvarado score told the ER physician he needed more tests. The plan was to transfer him to another facility to get those tests, and we were ready to sign off when suddenly he let out a long, musical fart. He unfolded his body and was all at once no longer in pain. 3 hours he was in pain. He looked at us and said, "I feel better. I'm hungry, actually." But the red swan had already taken flight. We couldn't just get up and leave the hospital. No, our fate was in the hands of the ER physician, who insisted we be transferred to another facility to get those tests and for evaluation by pediatric specialists. Her options for us: leave against medical advice and pay full cost for the visit, or accept transfer. In that moment, I could see how completely the red swan had blinded her to both the white swan of basic knowledge about gas pain in children and the black swan of obvious symptom resolution. When I pointed out that she was making a decision in service to her red swans, not in service to our son, she crossed her arms and looked at me. She paused, she thought, and ultimately she agreed to discharge us. One small victory over the red swan. My call to action is not just for those of us working in healthcare. The red swan haunts every field where human judgment matters and mistakes carry consequences. Teachers hesitate to challenge gifted students for fear of parent complaints. Police officers make split decisions colored by liability. Lawyers recommend settlement over trial to avoid risk. The red swan shadow is cast across every profession where fear can override what we know and our ability to find out what we don't know. But we can choose otherwise. Whether you work in healthcare or not, question your decisions. Are they driven by the needs of those you serve or red swan fears? Make a conscious decision to see beyond the red swan, to ask powerfully curious questions, to uncover the black swans, the unknown unknowns. In this way, together, we can create systems where information guides us, individual stories inform us, and we refuse to let fear blind us. Thank you.